Now we get to our trigger point section. So now we're going to use a softball, a little less surface area, it's a little harder than the foam roller. You can really dig into some deeper fascia, some deeper levels with this. It's better than the baseball because it's a little bit wider surface area and it's a little bit harder, so it's better than a lacrosse ball. So the softball is probably your best bet. So again, you're going to start off in the ankles and work your way up. Start off in the soleus, move it around. You can put your hand on top of there for pressure. You can find some spots that kind of feel a little spicy, and from there you're going to move your foot around side to side, up and down. And right there I find a trigger, and from here I'm going to move my foot into circles, trying to find those areas where I can feel it shooting up and down my leg, and hang out there and just focus on that exhale. Same thing on the other side. And you can spend a little more time if you want in this section. For the sakes of just the tutorial, we're going to go through this pretty quickly. But if you want to spend, let's say, a couple of minutes on each side, you could do that, just depending on how you feel, because every day is going to be different, right? So then from here we go up to the gastro. Again, here this might feel pretty funky also. So first you start in the middle and then work your way laterally. And immediately in the anterior tibia, you're going to feel a lot of tightness. Most people get a lot of tightness up here, so if you want to put the softball on the side here, put some pressure up and down, you can really feel some relief going down the top of the foot also as well, and it'll allow you to do some better dorsi and plantar flexion here. So same thing on the other side. Now you're not going to find, you might find that both sides aren't symmetrical in terms of tightness, so from there you want to try to find those spots. This is where you want to try to find those pain spots, while in the foam rolling it's more about promoting blood flow. Here you're going to make sure to try to find it a little bit and hang out there, and that's going to help release some of that tension. Now from here we go up to the hamstrings. So work your way up, start from a little bit behind the knee, but not too close to the knee, probably about 2 or 3 inches. And that's going to be the hamstring, like the really bottom, the distal part of it. From there we work our way up to the proximal part of the hamstring, aka the ischial tuberosity, which is the bone that connects the butt and the glute. That right there has 3 parts of our hamstring that's going to fan out. Anytime you feel any tightness in the hamstrings, it usually stems from there. So it's good to just always start with that softball, putting it nice and deep in there and moving side to side. And from there, you're going to find some areas where you can work in the medial or lateral area that might really hurt. And from that, that's when you can figure out, oh, it's shooting down the side of my leg, it's going up, it's going down, probably maybe your lower back. We do the same thing on the other side. Right to the glute butt connection. Now don't overdo it here, but just right, you want to find those areas and sit there. Remember, exhale. From here we work our way to the glutes. So this is one of the tighter parts. Usually the piriformis and the inferior glute capsula take up. They do a lot more work than our glute medius and our hamstrings and our glute max would. So these are going to be super tight. So you're going to put this on your butt. We're going to bring your leg straight out, forward and back. And also external and internal rotation. Right there you can feel some more probably on the outside, and you're going to find that spot. Maybe kick your leg a bit in and out. You can spend a couple of minutes on each side here. This will help you with some immediate hip / lower back relief. Your main goal is to be careful and not overdo it. And straight up and down, side to side. Now from here we transition to the hips. So you put the softball in the hip socket, but be careful. You don't want to go too deep into it and maybe stretch too much fascia that doesn't need to be stretched, if that makes any sense. So from here, let's put nice and easy, again keeping everything in proper positioning, and put the softball right into your hip socket. If you feel like it's moving around too much, you can put the yoga block on top, on the bottom, on the softball on top, to get more tension and also let it stay still. But for now, let's just put the softball in that hip socket. Now make sure, again, ribs down, proper positioning, flexion. Gonna move in and out, try to find some spots here. You might feel shooting up and down your leg, maybe your back, and just try to breathe in and out. But I wouldn't spend too much time. I would spend more time on your posterior side, like your glutes and your back, more than I would in the front. But I would spend about maybe 20 to 30 seconds on each side here.
Again, keeping those ribs down.
Trying to get deep into that hip where you might feel some tightness.